What's going on? Today I want to jump into a topic that I get asked a lot about. There seems to be a lot of misinformation and a lot of confusion surrounding this topic, and I think a lot of that has to do with the fact that people that are out there talking about this really aren't qualified to do so, and that is the subject of anabolic steroids versus TRT or testosterone replacement therapy, and even venturing into the conversation of peptides since they fall under this umbrella of performance enhancing drugs. So what I did is I drove up to West Palm Beach, Florida to visit my good friend Dr. Brett Osborn, who's a neurosurgeon, also dually board certified in regenerative medicine, anti-aging medicine, an expert in endocrinology. He also happens to be a certified strength and conditioning specialist. He is a published fitness author, and right here in Florida holds a state record in deadlift. So someone who is definitely qualified to speak on this topic. So I drove up to his office, had a great conversation, and I want to share some of that with you. So let's jump right into it. What is the proper definition of TRT? Everyone throws the word around, so what should TRT mean?
To me, it's like a locker room term. I don't use that term at all, which in my mind have the connotation of somebody selling you some sort of testosterone or some sort of alternate to testosterone, some sort of steroid in a locker room. As we get older, as you know, hormones falter, okay? But there's sort of like this symphony, if you will. So it's not just testosterone that you have to replace, or at least have to look at. You're replacing the entire span of hormones that govern our physiology.
Right, which can include obviously thyroid, down the list, depending on what may be out of balance that you're trying to optimize for a person's longevity or health.
Absolutely. Estrogen, progesterone, there are a whole host of hormones that you can sort of tweak, turn the knobs and the dials in order to make somebody a better version of themselves, in order to optimize their physiology, their biochemistry.
So what does proper testosterone optimization look like versus someone going to a doctor and it being prescribed, but now all of a sudden it's doctor prescribed enhancement because instead of maybe more natural testosterone levels, now all of a sudden their testosterone levels are jacked at 1,000 and above?
I don't believe in doing that. There are a whole host of potential side effects from testosterone replacement. Things like hypertension, thickening of the blood, which can predispose you to stroke and heart attack, thickening of the left ventricle, which can predispose you to hypertension, heart attacks, all sorts of other problems. So somebody who's 25 years old comes to the office and says, I want to be on hormone replacement or TRT. That's already a red flag. It's frowned upon. It is heavily scrutinized by the law, or under the law, I should say, in addition to the fact that males who are on any of these anabolics at an early age potentially it places them at risk for being permanently sterile or having significant difficulties fathering children. We have a lot of patients in our clinic who have been under extreme duress in their lifetimes. You know who I'm talking about. And those individuals, by virtue of that and by virtue of something that's called cortisol, they end up coming in with very, very low testosterone. And those would be the younger patients who actually do qualify. But they qualify by virtue of their symptoms, not by a number alone, and certainly not because they want to be big and muscular.
So compare and contrasting someone who comes in 40 years old and says, hey, I just want to feel more energetic. I want my libido to be back where it would. What's that range of testosterone where you would like to see that individual? And in contrast, what would it look like if someone was on that enhanced side?
Just let's say you're on 200 milligrams of cypionate, which is sort of a standard dose. Some people do it twice a week, 100 milligrams. An individual like that is going to be running on day 6 or day 7, somewhere around 1,000, and that's their total testosterone. Maybe a little lower, maybe a little higher. So just let's say it's a LabCorp request. They will run high 900s, some of them run 1,100, and they vary. You're not going any higher. That's where you're going. Anybody else is super physiologic, and we are reducing the dosages. Why? I'm not concerned about you being 3% body fat. I like individuals to be leaner because a leaner phenotype is a healthier phenotype to a degree, and a more muscular phenotype to a degree.
So let's say I come in, it's 200 milligrams testosterone a week. My levels end up 900, maybe 1,000,
Okay.
which based on blood work is kind of at the high end of the spectrum.
You're creeping up, yep.
So I don't think naturally, even in my 20s, I don't think my testosterone was probably ever at 1,000. So what would be that comparison, my 48-year-old self at 1,000 versus my 25-year-old self who might have been 700, 800? Wouldn't you still consider this 48-year-old version of myself now enhanced?
And that's a good question, and the answer is slightly you are, yeah. And the thing about it is that a bad thing? With medicine, the first thing you learn in medical school is first do no harm.
Right.
Okay, first do no harm. So if an individual feels great, their brain is working great, they're muscular, they're strong, they're motivated to go to the gym, which is a big reason to put somebody on testosterone, right?
Right.
They're motivated, they're spontaneous, they have that virility back. If they feel good at 900 and they're not hypertensive, I'm not having to go and have them phlebotomized, take blood from them every 3 months. Their left ventricle isn't thick, their prostate isn't enlarged. They may be, yes, enhanced. Is there something wrong with that? In my opinion, no. But I would make the argument that you're probably a better version of yourself at a total testosterone of 900 than you were when you were 25. So I don't have any problem with that. I really don't. Do I have a problem with you coming back here and being 1,500? That's not going to happen in this clinic.
Right.
You're not.
So this was a study that was done, testosterone dosage, 2.4% use less than 200 milligrams weekly.
Right, which is a very, very small amount, right, of people.
52%, so half, used between 200 and 600 milligrams weekly.
Right, and this is becoming absurd.
Almost 32% used between 600 and 1,000 milligrams a week.
Right.
10% used over 1,000 milligrams a week.
Right, and you wonder why these people are having issues. Keep in mind, whether it's growth hormone, whether it's some other synthetic, whether it's testosterone itself, keep in mind that you are injecting a growth factor into your body. These are growth factors, okay? Muscles aren't the only things that grow in response to growth factors. And those doses, just for those that are watching, are absurd. I take, 120, 150, sometimes 160 milligrams of testosterone per week, and I'm plenty strong. I have a state deadlifting record in Florida. I keep myself plenty strong, plenty fit on relatively small doses of testosterone, and I've had no health problems at all, zero, and I'm 52 years old.
So in a medical setting, someone goes into a doctor says, okay, well, I'm going to put you on, testosterone. I see your thyroid's low. I'm going to put you on some thyroid medication. Oh yeah, to help you maintain a little bit of lean muscle, I'm going to put you on Anavar. What are your thoughts on some of these other steroids or other medications that some of these doctors are putting them on?
So we use only bioidenticals here. So a bioidentical hormone is exactly what the word means. They are hormones that are synthesized in a lab, but they have the exact structure. As an example, let's take the testosterone. The exact structure of the hormone that is produced by the body, not some synthetic agent. So a lot of these substances, just let's call it an Anavar, an Anadrol, a Winstrol, these substances, a lot of them are hepatotoxic. So they induce changes in the liver, which can potentially predispose you to fatty liver and cirrhosis, and florid hepatic failure. There is absolutely no reason for anybody to be on anything aside from supplemental testosterone. These clinics, they are targeting aesthetics. In other words, aesthetics is the primary goal, and the primary goal should be health. I always say that the look is the side effect of the health. not the other way around.
So looking healthy, not being healthy.
Well, what do you think the sport of bodybuilding is?
Well, of course.
Those individuals, the majority of them are metabolic disasters. Their biochemistry is all awry. You may think erroneously that you look like a better athlete, but you don't. Everybody knows, what you're on to. Everybody does. Everybody, because everybody's doing it.
Male, female, you walk into a doctor, a really good doctor. What are the things he's going to put you on? What are the things, if you hear that, hey, this is maybe something I need to reconsider?
Ask the doctor if he or she is considering putting you on a hormonal replacement regimen. If every single agent that he or she is putting you on, if they're bioidentical. If the answer is no, find another doctor.
So on average, someone in their 20s, what would be considered really good, healthy testosterone levels?
So, again, the normals are ranges. I would say an individual, just sort of from an experience standpoint, in their mid-20s, 600, 700, maybe 800, something like that. You may see a little bit lower. You may see some people that are a little bit higher, but it's not going to be 1,000.
So if someone's 600, 700 in their 20s, they feel great. I felt great in my 20s.
Right.
Able to build plenty of muscle,
Sure.
plenty of energy.
Sure.
By the time they come in and they're a good candidate for real hormone therapy,
Right.
what would that normally look like? What do you typically see?
It has to do with their symptoms.
So it's not necessarily whether their testosterone levels are high.
No, it is not an absolute number. No,
Right.
It is not. Now,
Two people could have same testosterone levels. One person could be able to build muscle, libido could be high, energy could be high. The other person could have the exact same level and be the opposite.
see it all the time, and that's why you need to have the doctor writing this stuff for you, because they need to be attentive and listen to the person. It is symptom directed. The numbers are used to tailor treatment to make sure we don't have anybody super physiologic, not to necessarily initiate treatment.
Going back to the example of YouTube, people talking about the cycles they've done, being very transparent about it. One of them is this guy, Larry Wheels, very popular on YouTube, talking about been on steroids since he was 16 years old. Now, 10 years later, all of a sudden, I'm assuming he's probably faced with some health consequences, or
Sure.
at least the reality of it, saying, hey, I'm not going to do that anymore. Now I'm going to go on testosterone replacement therapy because my testosterone levels, natural testosterone levels, are shot after a decade of continuous use. Obviously, he's experiencing the symptoms of low testosterone, but being that he's 26 years old, do you treat that person the same as you would treat a 40-year-old who's got the same low testosterone levels? Or is there a chance for this guy to recover to somewhat more normal levels for a 26-year-old? Or has he caused permanent damage and now has to be on therapy for the rest of his life?
Right. So that's a good question. I would put him on testosterone to support him, because he's suppressed, and his total testosterone, if you took it away and you withdrew it, would probably be zero. And I've seen that, literally zero. So you have to support him, otherwise he will feel horribly, and he won't be able to perform across the board. So I would put him on testosterone. Then what I would do is I would also put an individual like that. We used to use HCG, which is now Pregnil, okay, and you can't get HCG anymore. It's very difficult. And I would put an individual like that on Clomid, okay? So we'd start him on Clomid, and then if he said, Brett, I want to have kids, what I would do is I would pull the testosterone down over time, and this may take a year, maybe two, bring the Clomid up so that he's making his own testosterone.
Clomid's stimulating the production, natural production.
Correct. And then I potentially could wean him completely off. But the answer to your question is, and just let me finish it, is that I don't know, and you have to do a trial, because he may not be able to respond.
One of the things I see even naturally, forget steroids, take that out of the picture for a second. Guys start training, especially lifting really heavy. Muscles develop really quickly, at least strength starts to shoot up,
Sure.
and it seems to shoot up quicker than the strength of our connective tissue.
Sure.
And I see a higher risk for injuring connective tissue, especially with young guys. Now you take anabolics and you add that to the equation. So you get a guy who's young, starts training, builds a ton of muscle really quick.
Right. Yep.
Says, let's talk about some of those risks, because I see that a lot. Tearing pecs, tearing biceps.
It happens all the time. Tendon, ligaments, joint health, they're all
not able to keep up with the muscle growth.
That's exactly what's going to happen.
It's like putting a 1,000 horsepower engine in a Mazda Miata. The transmission is just going to
That's right.
disintegrate.
That's right.
So obviously a benefit to developing strength and muscle size gradually over time, allowing the connective tissue to catch up. So
It's good, and it's good for here too.
right. Well, and it's like you said, it's, you know, the satisfaction of discovering what your natural potential is.
Right.
And I think going back to this guy like Larry Wheels, I think he said it in his own way. He doesn't even know what his own potential is for lifts, you know, a deadlift or a squat or a bench press. He has no idea.
Right.
Because since he was 16, he's been enhanced.
And he probably will never know, because I assume that he's on some sort of replacement therapy now. So he's never really going to know. Right. He has never had the opportunity to explore.
And his probably natural hormones will never be what they could have been.
They won't be.
Right. So let's say someone gets on testosterone when they're 16, 17, which is what we see now. How early on could you potentially see some of those health consequences?
It's a bad idea. It's a bad idea. It's short-sighted. The muscular gains that you are going to manifest are illusory. They're transient, and as soon as you stop, because you've developed some sort of health problem, they're all going to go away.
Right.
So it's a very, very, very bad idea. These individuals are going to be producing ample testosterone
when they're young.
When they're younger.
Yeah.
Right. So.
In other words, they could get great results.
They can get
without doing anything.
You can get terrific results, and you know what? Because the gains are not coming so easily, they are going to have to develop the discipline, the mettle, the stick-to-itiveness, the grit, in order to generate these gains. And there's nothing wrong with it. That's what builds, that's what builds character. By virtue of all this technology that we have, and I love all of this technology, everything is instantaneous.
Right.
And the same applies here.
Someone will post something on social, and you look at the comments, and it's like, he's on gear, he's juiced up. I look at the guy, and I see someone who's maybe 175, 80, 180 pounds. Looks great, but to me, a very achievable physique.
Sure.
Naturally.
Sure.
But I think people's expectations are all out of whack now, and they assume that everybody who's got a great physique is automatically on something, which is a shame to me. That actually kind of makes me sad.
It is saddening. The thing about it is that with ease of access nowadays, it's probably true.
What's a reasonable physique naturally? He's got average testosterone levels.
How old?
20s, early 20s.
Mm-hmm. So a decent amount of testosterone.
Yeah, he's in that 600 to 700 range naturally of testosterone. 160-pound guy says, hey, I want to put on 10 pounds of muscle.
Okay.
What can he expect naturally?
I would say 10 to 15 pounds of muscle, novice lifter, decent amount of testosterone floating around, and training for several years. I think that's not unreasonable. It's a little bit hard, James, as you know, because it also depends upon, and you know, you and I we're lean guys, on somebody's carbohydrate sensitivity. You may need to give it a little bit more of a push, and they need to learn to eat properly for their physique in the context of their goals. But I would say 10 or 15 pounds of muscle, which is, as you know, very significant if you're doing things properly and have avoided injuries.
If someone's considering taking any sort of performance-enhancing substance.
Okay, but I don't call them performance-enhancing substances.
No, I'm even talking about someone who isn't even going to a doctor. I'm just saying, if they're considering that, because let's face it, let's just be real about it. There's a lot of people out there that are considering some sort of steroid use.
Oh, sure.
Instead of being the guy who's saying, hey, I'm 16, I've been training now for a year, since I was 15, I'm not getting fast enough results, I think I'm going to jump on it. I don't agree with that. Why? Because he's looking for a shortcut.
100%.
If you're going to do it, to me, the right way would be explore your natural potential, get there, find out what your ceiling is, and then decide. Do I like where I'm at? And if for whatever weird reason you want to go beyond that, you want to be a professional bodybuilder or whatever that is, then that would be the reason that you would consider it at that point. But because you know what your ceiling is, you know, this is it. This is my genetic potential. I'm as strong as I'm going to get naturally. I'm as big as I'm going to get naturally. And if for whatever reason you want to be bigger and stronger than that, then I guess that's when you consider it, but certainly not before that.
Absolutely not. And again, I am not in favor of fiddling around with these drugs without, number one, very, very seriously considering the potential consequences. And I'm talking about not short term, I'm talking about long term. And number two, without doing it under the auspices or supervision of a physician.
So, well, here's the reality though. You're a 20-year-old guy. You started when you were maybe 16. You've been training for 4 years, made great progress, and now all of a sudden you're considering taking steroids. 20-year-old guy's just not going to go to the doctor and do it the right way. And that's the problem.
Right.
And then they're going to assume the risk.
Exactly. I was just going to say, then the risk is on them.
You know, we're talking about performance enhancement. I don't think that's just steroids. Nowadays, it's all the peptides. So peptides for growth hormone, peptides for inflammation, peptides for weight loss.
These are off-label agents. There are some emerging data. I have used on occasion some of the healing peptides like BPC 157 and things like that, and I do think that there's merit to some of these things. But some of these other, I'll call them performance-enhancing, growth-enhancing agents, stay away from them. They're poorly researched. The data is not there. We don't know what the long-term side effects of them are. They're switches, as you had said. The thing about it is that you don't know what they're turning on.
Right.
Good or bad.
Or both.
Or both. It is scary.
I don't know a lot about peptides. I've started looking into it because I've been asked so much about it. The more that I look, the more scared I honestly became for a lot of people because it's so accessible. You can find them everywhere.
You can, because they're unregulated. They're all over the place. No prescription necessary. Buy them online with a credit card, and you got your peptide.
Right.
It may be water, sterile water, or not sterile water, or maybe something else. It's scary.
Whether it's genuine or not genuine.
Right.
Right? That it's whatever it says on the label or the website is exactly what I'm getting.
Right.
But even if it's exactly what I'm getting, doesn't make it any less dangerous.
Correct. That's correct.
Because I still don't know, like you said,
That's correct.
down the line, I don't know
correct.
what this is going to do.
Until there are large, placebo-controlled, randomized trials.
It's almost like going into a cockpit on an airplane and just flipping a bunch of
That's right.
switches.
And just hoping for a good outcome, hoping that the plane lands itself.
Right. All right, so hopefully that answered some of your questions. If you have any other questions related to this topic or any others, please drop them in the comments below. I'll try to make sure to bring in other experts like Dr. Brett Osborn to give you the best and most accurate information possible. So I'll see you next video.